Okay, sexual abuse. Um, Again, we're going to, the reasonable grounds to suspect sexual abuse has occurred or may occur. We're going to make the decision right now. We're going to walk through the decision path, so we're not sure. We need to find out. So first of all, was touching behavior or remarks, that's the basic definition, of a sexual nature or sexual exploitation directed to a resident. So it's to a resident. If the answer is yes, or most likely yes, then this is the whodunit column. Was it by a licensee or staff member? Let's say, and this time we're going to say yes, it was by a licensee or staff member. And we're going to follow down this path. Now, notice it doesn't say immediately report because there might be something that changes that situation. So, was it of a clinical nature appropriate to the provision of care or assisting a resident with activities of daily living? Again, I say we know that there are some quite intimate tasks that people require assistance with or require to be done for them, that, and certainly a lot to do with, toileting and that kind of thing around the genital area. So was it of a clinical nature appropriate to the provision of care? However, there is sexual touching and there is care touching. Now, the question though, and there is also care that might not be physical, and actually an administrator said, feel free to use this example, that in her home they had a young female resident who was out and about in the community on a regular basis, lived in the long-term care home. And the home became aware that when she was out, she was engaging in sexual activity with numerous partners. And so what they did was they then had did health teaching with her about the best way to protect herself. And what the administrator said to me was, kind of somebody knowing of that or hearing of that might say, oh, well, this is in a way making sexual comments or remarks or whatever. In fact, it was health teaching and it was totally clinically appropriate to that particular situation and that person's needs. So in that way, that answer would be yes. And so that they would not need to report that. However, say the question is answered, no, it wasn't of a clinical nature appropriate to providing care. So the answer goes into a little more complex question. And what the question is about is the context of the relationship between that licensee or staff member and the resident who's involved. And it's about, was it about a relationship that existed before the resident became a resident or before the staff member became a staff member? And we know that especially maybe in a small community where there's only one long-term care home or two, that chances may be pretty high that somebody's spouse may need to be admitted as a resident and they are an employee in the home. And so because that's the context of the relationship, that comes in, that's the cause of this question. So then is it sexual abuse? Well, if the answer was that yes, it was in the context of that relationship that existed, then it's not immediately decide to report or not report, was it consensual? And that ends up being the key question in all of it. Was it done in agreement with the person, the resident? Was it consensual? If the answer is yes, then because it's in that context of that relationship that already existed, then the licensee manages through an internal process but doesn't need to report. So they might want to ensure that the people involved have access to better privacy, or that they provide support so the person can go on a leave of absence, if or whatever. So they may want to look and do a better job at supporting the people in those needs. But is it sexual abuse? No, it isn't in that situation, therefore not reported. However, let's back up here. Was it in the context of that previous relationship? If the answer is no, then that's very straightforward. Then so then it became a staff to resident, really a breaching of that staff to resident contract is really what it is, because you have a contract of care. That's a professional contract of care that's about giving care to somebody who needs care. So that's a breach of that, and that's immediately reported. Now, even if it was that previous relationship, Was it consensual? If it's not consensual, then it's reported. Because any sexual activity that isn't consensual is sexual abuse.
How does that pertain to someone that's cognitively impaired and they say yes?
All right, let's follow along because we're resident. Well, let's call them resident because that'll come up here too. So let's go back to the whodunit column. So was it by licensee or staff member? The answer is no. So in other words, it's resident to resident contact. Was it consensual? Notice this chart does not say it makes any difference about the cognitive awareness of people. So if the person doing it is cognitively impaired, it is still reportable to us. It is still reportable to the police. If the person, the receiving, the person who's the victim of this approach is cognitively impaired, if it's not consensual, it is sexual abuse, it's reportable to the police. Does not matter either way. However, the gray area and the question I think you're getting is about capacity. And the capacity isn't dealt with in our legislation, it's dealt with in the Consent and Capacity Act. And it's there are better and better tools all the time to help people determine the capacity of people to decide. Because we know that people have the ability to consent to some things and not others. They have the ability to consent to one thing at one time, but that very same thing perhaps not another. And that's where it's very difficult to know. And it's difficult, and what has to happen is that there has to be some understanding of the resident involved and their needs. And you know, has there been a psychogeriatric assessment that would help lead people to understand, was this person ever able to say yes or no? And that's a real gray area, because sometimes the answer is yes, a cognitively impaired person, and this is maybe a relationship that's important to them. And I also say, and our lawyers said to us, emphasize with the licensee, and I'll say it to you as well, that power of attorney for care relates to care and treatment. Power of attorney, or being a substitute decision maker, does not apply to anything sexual. The only person who can give or refuse consent to sexual activity is the person themselves. So we certainly know situations where loved ones, people who are obviously very protective of the resident in the home, feel that they can say to the home, don't let my mother have anything to do with that fellow. You move that fellow to another floor. Even though it's obvious that there is consent, even though mom may have some dementia, that it's a meaningful relationship and that she has the ability in those moments to say yes. So I just say that our lawyers said really emphasize that with the licensees. Now we're straying into capacity and consent, which I'm no expert in, which isn't the scope of us, but to acknowledge that yes, it is a really hard question. It's a really hard area. And again, if the home's in doubt, if you're in doubt, then take it further and put it in the hands of the people who then have to decide what to do about it. Question?
It's a situation where two people are competent, but the man's wife is in the room with him, but he agrees, and then there's the staff saying, well, it's immoral for him to be, so there's that kind of situation as well. That gets very tricky.
Yeah, very good point to make, because we all come, and especially in the sexual arena, we all come with a lot of our own values and beliefs and perceptions. And you do get the reflection of that, and it's particularly hard if it is a spouse seeing something like this happen. There was a fabulous movie not too long ago called Far Away. Was it Gordon Pinsent? And
without her.
Away from her, that's right. That dealt a lot with that. And somebody also at one of the sessions I did came up and said in the last season of Grey's Anatomy, if you watch Grey's Anatomy, that there was a really excellent episode also that dealt really well with that situation. It must be an incredibly painful thing for somebody to see, and something that the home needs to be really sensitive to. But in the end, if the resident is able to decide and consent, it's just the same as that resident was not a resident and living in the community and made a decision that way. So unfortunately, and as I said before, sometimes we don't have to agree with people's decisions. We just have to support them in their decisions if they're able to make them. So, but excellent point to make, and so true. And one of those things is like a human thing, not a legislative thing.
Because what makes it more complicated is they deny doing it as well, which makes it, of course, stops any communication with them, and then the other person as well, they get defensive as well and gets verbally aggressive, so that just complicates it.
It can be really emotionally charged. Yeah, really difficult. So I think that's all I want to say about the sexual abuse decision tree. But it is an area, as I say, where we all get a little sensitive some ways. And you know what? I think my work with long-term care has really, and with my dad's situation and everything, has really heightened my own awareness of my own mortality, you know, and my own future, and what do I want. While I still have maybe some chance to have a say, what do I want the world to be more like? You know, what's the ideal to work toward? And you know, we all have a hard time sometimes with this